Welcome to Cabral Concept. I'm Stephen Cabral, board certified naturopathic doctor, and today on a very special Total Wellness Tuesday, we're going to talk about how you can take control of your own health. So what I mean by this is a lot of people when they go to their doctor, now whether it's a functional medicine doctor, a conventional medicine doctor, or anyone else really that they put in charge of their health, is they kind of relinquish all of their power to this other person. And you have to look at it this way. When you go to the doctor's office, you are looking for that expert who is well-trained, well-studied to help guide you to whatever you might be dealing with in your life, what's ailing you right now. So let's just take, for example, you have high cholesterol. Very, common reason why people go to their MD and they say, well, what am I supposed to do about this? But the issue is this, you're not given any options except okay, your cholesterol is now high, it's over, let's just say 205 or so, and your LDL is 130. Okay, so the first thing they recommend, well, you should take this statin drug. And this statin drug is gonna help you lower your cholesterol. But that's the only option you're given. Yes, they talk about diet, they talk about exercise, but when have you ever been prescribed diet or exercise at your doctor's office except, why don't you try eating better and why don't you try doing some exercise? Like, what is that for a recommendation? That's not a recommendation. It's just saying, do a little bit of this, do a little bit of that. Hey, if it doesn't work, maybe come back. No, by malpractice-based laws, if you come in with high cholesterol, you have to be offered really a statin. Because what if something were to happen? What if you were to have a heart attack and you weren't prescribed a statin drug and you had high cholesterol? Well, someone could be liable, right? The nice thing is, in my practice, since I don't take health insurance, I don't have to play by those same rules. And also in Massachusetts, you're a board certified naturopathic doctor, you're not a licensed medical practitioner, because with naturopathic medicine, you're only licensed in between 11 and 13 states right now. They go back and forth between the actual legislature, depending on who can be licensed and who's not. But regardless, I would never take health insurance in the first place. And I know that excludes a lot of people that I would be able to work with, and I do feel bad about that, but it's also why I create a daily show answering all of your questions and just trying to provide a ton of great free content. Because I can't work with the world, I can't work with everyone, and neither can any doctor out there. So let's get back on topic. What I want to say is this, is that if you're going to play by the health insurance medical-based practice rules, you have to understand you're confined in this small little box, and you have to do what the American Medical Association says. Those doctors have to play by those rules because of their malpractice insurance as well. And also you have to play by health insurance rules. You have to, if you come in with high blood pressure, you have to be prescribed with a calcium channel blocker, a beta blocker, or something like that to help with your blood pressure. High cholesterol, great, you get a statin. You have heartburn, okay, you're taking Prilosec or a proton pump inhibitor or something like that. And the reason you're doing these things is because there's a chart that says if you come in with Y, you are given X. That's just the bottom line. That's how the system works. My advice to you is this. Don't take that at face value. You should allow yourself more than one option. Why not? It's your health. I mean, the crazy thing is this, in any really other aspect or facet of our life, we would always try to take control of our own life and our own bodies and our own things and whatever it is. But yet when we go to the doctor, all of that is just given up. It's like, oh, okay, whatever you recommend, I'm gonna do. I see that as a little bit of a lack of control for yourself, but also almost like, I don't know what the right word is here, but it's kind of like you've relinquished all control to someone else who doesn't know your body maybe as well as you know it yourself, and that there are so many more options that you could explore. And keep in mind that any pharmaceutical drug that you are given is going to have a side effect. That's just the way it is. And that pharmaceutical drug is going to mask the symptoms of high cholesterol, let's say in this instance. But high cholesterol could be a symptom of high inflammation. And if you have high inflammation, your body could certainly produce more cholesterol to help with arterial-based micro tears and things like that. So it could be a normal response to inflammation. And then inflammation could be a response to digestive-based disorders. And you could just go down the line. But what happens is once you take that statin drug, you're basically putting a Band-Aid over this deep wound just so that you don't see it anymore. But you never fix those underlying things. I actually love the symptoms. I want people to come in with a high cholesterol, the high blood pressure, whatever it is. So as we're rebalancing their body and their blood pressure is coming down naturally, cholesterol is coming down naturally, well, guess what? Like, we know that it's working because those symptoms are getting less. And if they ever start to creep back a year or so from now, totally fine as well, because we know that they're off track from what their body needs. So what I'm trying to tell you is this. You don't have to disagree with your doctor, but it is okay for you to explore other avenues. If you have high cholesterol and it's 230, 240, 250, you have a few weeks. This is not immediately life-threatening. You have a few weeks to explore other options and avenues. That's okay to do. I actually see nothing wrong with that. Now, if your blood pressure is 200 over 100, well, at that moment, if you don't know what to do, you're probably going to have to take a blood pressure lowering medication until you can meet with someone who knows how to lower your blood pressure naturally. So just keep in mind that I'm a realist, that I am a true, what I believe, integrative-based doctor, that I will allow for the conventional medicine when best used, in acute-based circumstances. You could potentially have a stroke with high blood pressure. Lower that. Don't have a stroke. But at the same time, find a natural way to lower your blood pressure, because I work with so many people on high blood pressure medication and they feel terrible. I mean, they really do. They feel absolutely awful on the medication, but they don't know what else to do. We come in, we figure out what their deficiencies are, what their toxicities are, we go about rebalancing that, they get better. Why? Because we're not treating the high blood pressure, we're treating the underlying imbalances and causes. So please take control of your health. It is your body. Literally, it's the only body you get. Don't give up that control to anyone else. Decide what's best for you, but go at it with from an education-based standpoint, which means don't just not do what your medical doctor says. If you're not going to, you better have another plan, because you can't pretend that it's not there. So hopefully that I don't know, maybe gives you a little bit of feedback on a topic, and hopefully it empowers you. You shouldn't feel empowered. You should feel empowered when it's your own body. It is your own body. You need to take control of it. It's the only one you have, and it has to carry you throughout your entire life. Thank you for joining me today on the Cabral Concept. I'll be back real soon with more topics.